Well, health workers at Groote Schuur down in Cape Town have given a fascinating insight into how the most famous hospital in the country adapted to the COVID-19 pandemic. As we know, there's a number of units involved down at Groote Schuur, whether it's high care, ICU, etc. Well, head of Infectious Diseases and HIV medicine at Groote Schuur, Professor Marc Mendelson, a regular guest here on eNCA, joining us this morning. Morning to you, Prof. Mendelson. Always a pleasure. So take us through what the experience has been like at Groote Schuur. Physically, it is a massive, massive hospital, but it seems to have adapted very quickly. And it seems, and tell me if I'm wrong, it seems like at least some good news in the fight against COVID within the hospital structures.
Yeah, well, good morning. Yes, I mean, as for all hospitals in South Africa, Groote Schuur has really seen a very strong third wave. And we've been extremely full. We have general wards, high care, 3 high care units for COVID, and an expanded intensive care unit. And our job is obviously to look after patients, and that is what we normally do. The difficulties, I think, during COVID has been the intensity of the issue, not just the number of admissions, but how sick the patients are that are being admitted, and losing so many people, particularly the hardest thing is to lose the young. Saying that, we've also had a lot of successes and wonderful resilience, people coming through adversity and even long periods on intensive care units. But overall, it's been an extremely difficult time, both at my hospital and at all hospitals throughout South Africa, for all healthcare workers who have really faced extremes.
And Prof, and unfortunately, we have to then also talk about this expected fourth wave, supposed to land here, arrive here in SA. We've been hearing one about November. What are you hearing, and how could you prepare for this? How concerned are you?
Well, we're very concerned, particularly with the low vaccine uptake. We believe that the fourth wave is going to occur. I don't think anybody can actually tell you when it's going to occur, but if you look at the curves from the first, second, third wave, and look at the periods in between, then it's likely to occur at the end of the year, unfortunately. So, of course, we're concerned. I think all hospitals in South Africa are better prepared now for how to tackle this, but it depends. It depends on so many different things: the variant, the numbers, everything. So yes, we're concerned.
And staff. I mean, we were talking about how staff were trying to handle the physical trauma that they're going through, the emotional trauma, and that's when we were still in the second and now obviously the third wave. There's just no break for these incredible healthcare workers. Now they're going to have to strap up and get kicking again for the fourth wave. How are they coping? How are they doing?
Well, again, as I say, this is our job, but it's the degree of what's been happening. And we're dealing with an extremely traumatized health service all the way through all healthcare workers. And, the real difficulty, as I said, is the intensity of it, and the amount of trauma and, emotional trauma, moral injury, particularly having to prioritize patients. And so seeing many of your patients dying who maybe wouldn't have died had, one been able to provide unlimited resources. But that's not the situation that we're in South Africa, or in fact in any country, but particularly here. And so we've seen a lot of moral injury in and trauma in our health service. And I think the healthcare workers in South Africa are deeply traumatized, and they need a break. There will be a lull. We hope there will be opportunity to take leave and other things and try and recuperate to the next wave. But that's the reality.
As we look at a photo here of one of the wards, Prof, one of the obvious reasons we wanted to talk was because one of the COVID wards has been closed down for the moment as well. Tell me about that.
Well, that's normal procedure. So obviously, as a surge and a wave increases, we open more wards and resources for the need. And as the numbers come down and the admissions reduce, then we will try and consolidate our wards. At Groote Schuur, we have 3 high care units One of those we've been able to close for the moment, and now our patients are consolidated on 2 of the high care units. So, again, it allows some respite for staff. It allows consolidation of services. But, if once COVID reduces, we are still faced, obviously, with doing our job, which is to treat all patients, COVID and non, and the non-COVID patients also need an enormous amount of attention. So there isn't really a break. And this is one of the problems, I think, that the health service is facing.
Just a final question to you, Prof. As we spoke about the 4th wave, this closing down of this COVID ward, obviously that would be temporary. This would come back into play if it's needed during the 4th wave, if people don't go out and get vaccinated. I imagine just like a switch, the experts that you are can bring this back online very quickly.
Absolutely. I mean, and I think as we've learned more and more through each successive wave, I think the hospital administration and the way that space and beds are used has become easier, and this ward will just reopen as needs be. And nobody can predict exactly what's going to happen in a 4th wave. There are too many variables, but it's ready and open, and at present we're still going strong on the 2 other high care wards in our hospital.
Well, what we do know, one variable we can count on is that the incredible staff at Groote Schuur Hospital will do everything they can. Professor Marc Mendelson, congratulations to you and your staff. We await this 4th wave. We wish you all the very best. And this is why we need to all go out and get vaccinated. Head of Infectious Diseases and HIV at Groote Schuur, Prof. Marc Mendelson.